Hello, everyone, and welcome to the second session in our FHIR-side Chat series, where we sit down with the leaders across the healthcare ecosystem to talk about the role of interoperability, EHR integration, and community collaboration, empowering more connected, person-centered care. My name is Priscilla Daboni from Unite Us, and today I am joined by Sue Powers, Chief Growth Officer of Elligint Health. Elligint Health is a care management system that is leading the charge of innovating healthcare by aligning stakeholders, delivering intelligent healthcare solutions, and empowering proactive whole person care across the healthcare continuum. And to briefly introduce you to our guest of honor today, Sue Powers is the Chief Growth Officer at Elligint Health and was previously the Chief Growth Officer at Virtual Health, which she joined in 2016. Healthy C and Virtual Health, they joined forces earlier this year to form Elligint Health. So prior to her time with Virtual Health, she'd been in healthcare sales and sales management for more than 20 years. In her free time, Sue loves spending time with family and friends, working with charitable organizations, and playing pickleball. Sue, it's a pleasure to have you. Thank you so much for joining us today.
Oh, thank you, Priscilla. It's a pleasure to be here.
Awesome. Well, to start us off on an easy question, I was wondering if you could share a bit about Elligint Health and your role there as Chief Growth Officer.
Sure, happy to. So as you mentioned, Elligint Health, we're a healthcare technology company focused on whole person proactive care. So what we really focus on is trying to make care more proactive, connected, and actionable. And we do this by providing the data and all the information, both clinical, behavioral health, as well as social data to the care teams that we work with to make sure that they have a full picture or that whole person picture of any individual's needs. And as a chief growth officer, my work is really to try to expand our mission of having that care be more proactive and whole person by building strategic partnerships that extend the value of our ecosystem. So we want to partner with amazing technology companies who can expand what we're doing from a value perspective. And that certainly goes to what we do with Unite Us to expand that value into the communities and bring that to the people who really need the care and to improve their health outcomes. But ultimately, what I see my job is to help Elligint grow in a way that helps the ecosystem just become stronger, more connected, and essentially more sustainable as we move forward.
I love that piece about more sustainability. I imagine that in your role as Chief Growth Officer at Elligint Health, but also at Virtual Health, I'm sure there was just growing recognition that in order to improve outcomes, it's essential to address non-medical drivers of health as well.
Sure.
From your perspective, what is driving this demand for more proactive, connected care? And how is Elligint Health embedding that philosophy into its platform and partnerships?
Sure. Yeah. So I think the demand for that is being driven by the understanding that health outcomes are shaped far beyond the clinical walls, right? We know that the clinical care is, from a health outcome perspective, makes up about 20%, and 40 to 50% is really focused on those social determinants of health. So it's a major driver into how people are going to be affected in their health. We talk sometimes internally about sick care. That the U.S. tends to be focused on sick care, so the reactive part. And what we really want to try to move to is true health care, where we are ahead of that and we are doing proactive work to try to keep people healthy. And some may have the exact same condition as another person, but because of those social determinants of health, the outcomes are worse for them. And so what we have tried to do is embed the philosophy directly into our platform. And we do it through partnerships of trying to make sure that we're focused on not only that clinical side, but also those social needs. And we do that through partnerships, as I mentioned, so that we can provide our care teams with that full picture and really focus on giving them the support, them being the patients and the members, giving them the actual support and services that they need so that we can have that ecosystem that's going to impact those health outcomes in a way that's going to be meaningful to those patients and members.
And I would imagine that focus on partnerships is what led to this partnership, right? Elligint and Unitas's integration. It enables healthcare organizations to connect to their patients and their members to community-based resources directly from within Elligint's care management platform. Would you mind telling us more about what inspired this partnership and what common challenges Elligint is aiming to solve for with this integration?
Sure. Yeah, the partnership with Unitas was inspired by a shared commitment, I think, to addressing those non-medical drivers that affect health and our barriers to wellness. And we have clients, a lot of clients, and when we've talked to them, some of them have have had 3-ring binders on their desk, right, from a community resource perspective. So they'd grab those and they'd open it up to try to help one of their members or patients find the resources they need if they've got food insecurities or homelessness issues, etc. And that is not effective, right? That is outdated quickly. Care team can't track what a member's doing, etc. So we said, we need to do this differently. We need to do this better. And we were able to have the fortune to talk with Unitas and say, they're doing it the right way to make sure that we are being able to solve the challenge of getting those community-based resources in a way and into the hands of the care team where they can proactively understand the resources that are available, and as well as then do the referrals and have the closed loop, which means understanding, did that service get rendered? Did the patient or member actually take that service and then leverage it and see what the status is? Is it an ongoing service, et cetera? And so all of that really makes a difference in how we partnered and the impact that we're having in the community. That closed loop approach is what makes it more sustainable from the perspective of it's embedded in the clinical workflow. So it's in the same workflow as the managing clinical care. So now you have them side by side, working effectively in that whole person approach. And for us, we think that is the secret sauce, if you will, and making sure that whole person care can truly be actionable and scalable.
I imagine for those who are following along live, they can resonate with some of what you said, right? From moving away from paper records to being able to document closed loop referrals and actually fill in the full 360 sort of picture of care for an individual by having, insight into that whole person care. I think that just highlights that across the board, there are just so many different workflows and challenges that absolutely can be improved on with integration. At a high level, would you mind walking us through what this integration looks like from a provider's perspective and what it enables in terms of workflows, care coordination, and just overall efficiency at the point of care?
Sure. Yeah. So basically, the closed loop approach allows for a user of the system to be able to, by the click of a button, right, get to see. First they can go into the Unitas platform. So what we've done in our integration, we've said, we don't want to create what Unitas has done. So that's that ecosystem of care. So we have what we call connected app capabilities, and so we connect to the Unitas app, but we do it in a way that allows it to be seamless. So with a click of the button within our platform, which is called Helios, the user is able to go to Unitas with the appropriate information about that member or patient, who their care team is, et cetera, and then build the appropriate referral that they want based on the Unitas data and community-based organizations. From there, they're able to see the status of that referral and make sure that there's progress being made with that member. And what we do as well to have that closed loop is pull that data or that status information back to the Helios platform for the care team to see. So now they have at their fingertips all the community-based resources that any individual patient or member is getting, see the status of those services, and know if that referral needs to be worked on or not. And if a new referral needs to be given, then they can do the same thing, go back out to Unitas, create that referral, and again, within Helios, see that status update and know how that's going, along with how someone is doing clinically. Now, what it does, from the perspective of workflows, is it really streamlines the care team's communication. So rather than having to pick up the phone, call those CBOs or providers or care coordinators, everyone can now see it in the platform and see where things stand at any given time. And that, of course, reduces that manual follow-up, which is critical for the efficiency and productivity of the team. It allows for integrated care planning, so that we believe in whole person care, as I've mentioned several times. So even within the care plan for any individual, it's not only clinically based, but also social needs based. So we can have that care plan updated with all of the different things that are affecting an individual, whether clinical or social. And that makes for a more whole person focused plan and improves those health outcomes. And if you think about, care coordination, again, better handoffs, right? So the communication is better, manual intervention is reduced, and handoffs are better because all the appropriate information that is needed is at the fingertips of the folks, so that you don't have members, patients falling through the cracks, right? So that you have the information you needed to actually try to help them in whatever circumstances they're dealing with.
That was a very helpful description. I myself am not an end user, but I feel like I was able to envision the experience for those different users and sort of, as you described, how that integration really helps improve their workflows and being able to tie whole person care into their everyday healthcare workflows.
Yes.
I know what you just described was the integration specifically between Elligint and Unite Us, but I would say even outside of this partnership, Elligint has made some recent headlines for its work making healthcare more actionable with innovative technologies. How do
Yes.
partnerships like this one with Unite Us, how do they fit into your larger innovation strategy?
Yeah. So, we think that, again, more connected, actionable, and patient-centered or member-centered is the key. And so technology alone doesn't solve all those challenges. And certainly one company doesn't have all the expertise to solve the challenges we're talking about. It takes an ecosystem. It takes the interdisciplinary care team. So it's technology with people. And so what we've done is said, okay, we're going to extend our platform beyond the clinical care into that social and community domains, making sure that we can improve health outcomes. We do that through the key partnerships we've been talking about, as well as having the user base be that interdisciplinary care team. So those CBOs out in the community can be part of the platform and be able to have an impact through that. I mentioned connected apps earlier. Connected apps is our way to do a lot of our partner integrations. It's pretty straightforward, seamless, and allows our clients to get up with those integrations very quickly. The other thing that we're focused on to try to continue to be as innovative as we can is a thing called NQL, which is narrative query language, which is part of that whole AI. And so figuring out what's the right approach, how do we leverage AI into our platform so that it has the most impact that we're trying to achieve with that kind of technology. So we're working through that, figuring out the right approaches for our system and our company. Also, real-time dashboarding. So the ability for our clients to understand at any given moment how their organization is performing, how their members are doing. Are there early warning signs and alerts, proactive intervention that needs to happen that they can be alerted through our dashboarding? So we're trying to make sure, again, that proactive care is top of mind. We don't want sick care. We want health care. And then predictive health. So not looking at what's happening at this very moment, but what could happen as someone advances. So things like predictive risk analytics around someone who's going to have rising risk over the next 3 to 6 months, the next 12 months, in a variety of ways, not just clinically, but it may be those social needs as well. And, their circumstances, where they live, their economics, et cetera, all play into that and can certainly affect their health. And if we can get ahead of that, and our clients can get ahead of that, they can make a real difference in keeping people, out of the hospital and handling the programs for their potentially their chronic conditions that need to be managed.
Mm-hmm. I really appreciate the examples you gave. You talked about NQL and using AI,
Mhm.
and you talked about your predictive risk analytics. And I think that highlights something that I found on Elligint Health's website a few weeks ago as I was preparing for this conversation. And it
Uh-huh.
was the phrase, anticipate what's next.
Yep.
And I loved that phrase. And I love everything that you just shared because I think it highlights that healthcare is moving very quickly and it is very complex. There
Yep.
are many different approaches that we can take to tackle the various challenges that we can identify within this space, but it's
Mhm.
so critical that those innovations are keeping up with those shifting requirements and standards in
Yep.
healthcare. And that's why
Yes.
we're here talking about FHIR, right? It's a growing sort of standard and requirement in this space. What role do you see FHIR and just other interop standards
Yeah.
playing in improving how organizations share, track, and act on drivers of health data across the broader healthcare ecosystem?
Sure. Yeah. So from our perspective, interoperability is key to so many things, right? The real-time need for data so that you can, again, make proactive determinations and can make predictive determinations quickly. If you don't have the data, if the data is siloed and you don't have access to it, or you have access to it, 30 days later, you are not able to do the things that really are going to make matter and make a difference in improving healthcare. So FHIR is a wonderful, piece of technology and standard that is going to help us achieve that interoperability. And we've had standards for many, many years, right? This is not a new thing, but I believe FHIR is catching on to where there are people embracing it on all sides of the healthcare continuum, and that's going to make the difference. So once we get rid of those silos of information and fragmentation, then we can truly act accordingly, which is to have that real-time data coming into the system so that the care team can respond in time, right? If you respond too late, then you've missed the opportunity to really have an impact. And so that's the key thing. And if you think about interoperability, you think about FHIR and you think about different industries. I like to use the banking industry. Think about an ATM. You can go up to any ATM and get your money, regardless if you bank with them or not. And that's really where we need to get to in healthcare. We are quite disparate. We've got, clinics, providers, insurance companies, et cetera. But we can all come together leveraging these standards and have that data flow be something that will allow for us to have that real-time data that's shared across the continuum, which then allows us to move from aspiration to reality and focus on having that data be real-time and actionable as we move forward. And not just, again, on the clinical side, but also on the social side as well.
Yeah, I really appreciate that banking example because I think it sort of gives you a tangible idea of truly how connected we could be if we, as across the market, established these standards. And I think FHIR is beginning to be the new kid on the block for a lot of these systems who are just beginning to familiarize themselves with the different standards and options that are available to them to improve and integrate non-medical drivers of health into their everyday workflows and to remove some of those silos that you just described.
Mm-hmm.
What would you say are the types of organizations that are best positioned to benefit from this integration between Unitas and Elligint?
Yeah, so I think the organizations that are best positioned are truly those organizations with high priority, high risk populations, where social needs will have the greatest impact on the health outcomes, and therefore they're best positioned to benefit from our integration, assisting the vulnerable populations with both clinical and non-clinical is what's going to make the difference to improve their health outcomes. And so the ones that I think are going to succeed are those that see social and clinical care as inseparable, and they build that process around that philosophy. Therefore, they are bringing both types of data together and trying to impact each of their members across both spectrums. So that's who we focus on, and that's who I think makes the most sense. So if you think about the Medicaid population, many times they have those needs. LTSS population typically has that need, along with the, in Medicare, there's sometimes a lot of those needs as well. They could be lonely, they could have the chronic conditions, they may have issues with food, financial, and even homes. So a wide breadth of the population needs this, but I tend to think that the healthcare organizations focused on government populations of Medicaid and Medicare tend to maybe get the best benefit because of the population.
Mm. And I appreciate that description, because that could be a payer, right? It could be an ACO. It could be a value-based care provider. I think there are a lot of different types of organizations that would fall within the category of serving high priority, high risk populations, and sort of would absolutely find benefit in this integration, whether that's empowering themselves to be more proactive or simply guiding their users to have more informed decisions directly at the point of care.
Right. Agreed.
So as we, Elligint and Unitas, as we approach nearly 3 years of this partnership, I'm curious to know what feedback you're hearing from Elligint customers who are using the integration, or even just exploring the integration. Are there any notable stories or impacts that you could share with us?
Yeah, I think there is. As we've moved forward in the partnership, what I've seen over the course of time is that the customers and prospects that we talk to, they're embracing the importance of leveraging a closed loop approach to social determinants of health. So, everyone's recognizing the importance of it. And, when we think about the importance, right, we talked a little bit earlier about it, but clinical care accounts for about 20% of health outcomes, and then social, economic, and environmental are closer to 50%. So it's critical to bring this into play. And some things that we've heard from our clients as they've done, their kind of research is that people who are living in low income neighborhoods may live 10 to 15 years less than those in wealthier areas, because they don't, even though they might have access to the same healthcare, their access to stable housing, safe neighborhoods, healthy food, et cetera, is so much less that their life expectancy is impacted pretty significantly. And then, chronic conditions go up. So the desire to try to help people who are in maybe those lower income environments who have food deserts, right? Well, if they're in food deserts, a lot of times then obesity increases and diabetic risk increases. So again, our clients are saying we have to try to make a difference in that area so that we can keep these people healthier, out of the hospital, et cetera, because a lot of them do end up in the ER. And that's an expensive way to get healthcare. So trying to limit all that is what we've heard from our clients. And you also have the list goes on and on. But in short, where people live, learn, work, and play, it has as much, if not more, influence on health outcomes than access to medical care. And so our clients are hopeful that by leveraging both that clinical and social determinants of health through our partnership with Unitas, that they can address some of these issues early and keep people out of the hospital, but also living longer and being much healthier.
Mm-hmm. I think it's so important to hear these real world examples of how the solution is actively helping to impact communities and lives. I think it's so easy in this SaaS technology space to get caught up in, the conversations about innovation and solutions and FHIR. And it's easy to forget that these solutions that we implement, they are directly impacting patients and communities as well as users and the overall care coordination experience across entire communities. So it's not just about doing the work, right? We have to make sure that we're doing the work correctly the first time. And a key part of that is implementing standards that are sustainable for the future. And I think that that's definitely in line with what you've shared so far and sort of the vision for Elligint Health. I'm curious to know, what do you think is the next chapter of care coordination, and what will it look like, especially as I'd say technology, data standards, and expectations continue to evolve?
Yeah. So I think the next chapter is around true integration. We aren't there yet, right? We're talking about it. People are playing with it, but the industry is not there yet. So we have to continue to move to that integration where everything is brought together. It's not siloed. And today, in many, many organizations, it's still very siloed. So we have to bring it all together through data, through technology, and enable that 360-degree view of the individual. And again, it's both sides, the clinical and the social needs, so that the some of the basic things that happen now can be expanded to where they really truly can make a difference, leveraging that predictive analytics, the standards like FHIR, AI-driven insights, to where we can really anticipate the needs before they escalate, which is going to be key. What we see as well is that expectations are shifting amongst providers, amongst patients and members. They really want their care to be seamless, right? To be like other industries are. So and they want to be engaged in their health and to figure out how do they make a difference and stay healthy. So bringing technology to bear on that issue is also extremely important. And what we see our role is to help build that infrastructure where that vision is possible, right? Where we have data at our fingertips, where the consumers are engaged in their health outcomes, and that we can actually make substantial improvements to the health of this country and the cost of health in this country, which is, continues to go through the roof. So to me, the next chapter isn't just about coordinating care. It's about orchestrating it in a way that feels connected, timely, and impactful for every individual, so that everyone is now truly focused on trying to stay healthy.
Mm-hmm. Absolutely. And I would just add on to say all of that and continuing to make sure the work remains person-centered. Yes. Everything that we do remains centered around the actual people that we're serving. Absolutely. Okay, I have one last question for you to close us out. Okay. What advice would you give to healthcare organizations that are looking at how to expand their own capabilities to better support non-medical drivers of health? And what is one key takeaway you hope they remember from today's conversation?
All right. So I guess my advice would be to start by recognizing that doing something and addressing non-clinical drivers of health is not a side thing. It's not a side initiative. It's central to improving outcomes and controlling costs, right? Mm-hmm. So in my opinion, the first step is build partnerships with community-based organizations through your organization, and then align around those shared goals so that you can really address the needs that are out there. Second thing would be invest in technology, right? And the data structures that enable the things that we've been talking about so that you can make them actionable. And then finally, work, it's a strategic initiative, but work incrementally. So start with high priority populations that we talked about, where social needs have the greatest impact, and then learn from that and expand from there. Everyone could leverage social needs. Everyone has some social issues that they probably are dealing with, but start with that most at-risk population and go from there. And from our perspective, leverage partnerships. It takes a connected ecosystem to make a difference in this space. And my closing thoughts, I think, would be that, the organizations that lead in the future will be those that see, and I've said it a couple of times here, but they see medical and social care as inseparable. And they put the infrastructure in place to support whole person care. And by doing that, I really think that we can make a difference.
That was perfect. Thank you so much, Sue, for your time. It was my honor. Thank you for joining us and sharing your perspective and insights. It is so exciting to see how our partners like Elligint Health are really leading the charge in helping providers deliver more connected, community-centered care. And to everyone watching live, thank you so much for joining us. If you're interested in learning more about how Unitas can integrate with your EHR workflows to connect patients to care in the community, please connect with our team at unitas.com to continue the conversation. We'll see you next time.
Thank you, Priscilla.
Thank you.